Okay, so first I'll point out the frontal bone. The frontal bone is separated by the two parietal bones by the coronal suture here. The two parietal bones are separated from each other by the sagittal suture here. Next, you have your temporal bone, which is here, right here. That's separated by the squamosal suture, and that separates the temporal bone from the parietal bone. Next, in the posterior view here, you have the occipital bone, and the occipital bone is separated by from the two parietal bones by the lambdoidal suture here. First, to point out, the frontal sinus is located deep beneath the nasal bone here. Next, you have your parietal eminence, which is located on the parietal bone here, in the area where the bone ossified here. Next, you have the mastoid process, which is located right here. And then you have the styloid process. I'm just gonna pick the skull up here. You have the styloid process, which is located here. And then next you have your zygomatic process here. Then you have your auditory meatus here. And next I'm gonna connect the mandible so you can see the mandible fossa here, TMJ. All right, so I'm gonna remove the top of the skull here. I'm gonna show superior view here. So first you have your sella turcica, which is located here. Next you have your greater wing of sphenoid located here, and you have your lesser wing of sphenoid located here. Next, you have your pterygoid processes, which are located here on the left side and here on the right side. And your sphenoid sinus is located deep in this pocket here under the lesser wing. Next, you have the ethmoid bone, which is located right here. And also right here, you have your crista galli. Next, around that crista galli, you have your cribriform plate. Next, you have your perpendicular plate, which is going to be located in the front here. And the nasal bone in the middle here, medial of the body. Perpendicular plate. Next, you have your superior nasal concha, which is located deep beneath the nasal bone. Next, you have your ethmoid sinus, which again is located deep beneath the nasal bone. And next, you have your middle nasal concha, which is located right here, on the top here, right here. And that is all. Thank you.
All right, so for the facial bones, these are the lacrimal bones right here on both the insides. The nasal bone right here on the top. The vomer on the inside. The inferior nasal concave are on both sides on the bottom. The zygomatic bone right here. The temporal process of the zygomatic bone is right here. The maxilla is considered this front region right here. The palatine process is right here. The palatine is right next to it. The maxillary sinus are right on the inside right here. They're a cavity on the inside. The mandible, which is actually considered the jaw. The body is this region right here. The ramus is this region right here. And the mandibular angle is right here, as well as the coronoid process and the condyloid process. And lastly, you have the hyoid or hyoid, don't really know how to pronounce it. It is not a facial bone, but it is inferior to the skull. And you can see that that is right there.
All right. so there are 5 regions of the vertebral column. The first is the cervical, which consists of the first 7 vertebrae, and then you have the thoracic, which is the next 12, so somewhere around here, and then you'll have the lumbar, which is 5 vertebrae, and then at the end you'll have the sacral and the coccyx. So the sacral and the coccyx are fused together. The sacral consists of 5 discs, and the coccyx can be 3 to 5. And here's actually a better representation of the sacral and coccyx. The coccyx is at the end, right at the tip, and the coccyx in some vertebrates is actually the tail. There's 2 primary curvatures and 2 secondary curvatures to the spine. The first secondary is the cervical, and the lumbar, which is the second secondary, and then the primaries are the thoracic and the sacral. Okay, so the way you can tell atlas and axis apart is by this odontoid process right here. So this would be axis, and this would be axial. This would be axis, and this would be atlas. Sorry. So this odontoid process actually allows the up and down movement of the head, while these like kind of pads allow the side to side movement of the head. This is the anatomy of the actual vertebrae. So you'll have the body right here, this big bulky part. This is the vertebral foramen, which is the little hole, and the spinous process, which is down here. The superior articular processes and facets. The inferior, remember, superior is on top, inferior is on the bottom, and then this transverse process, which sticks out to the side. And there's actually 2 parts of the body. The outside is known as the annulus fibrous, and the inside is the nucleus pulpus.
For the sternum, this is the manubrium. The body, xiphoid process. Clavicular articulations of the manubrium would be right here. For the ribs, this is the costal cartilage. True ribs are 1 through 7. That would be 1, 2, 3, 4, 5, 6, 7 on both sides. False ribs are 8 through 10, so that would be 8, 9, and 10. The floating ribs are 11 and 12. That would be 11 and 12.
There are 27 bones that makes up each hand. There are 3 different parts of the hand: the carpal bones, the metacarpal bones, and the phalangeal bones. There are 8 bones that makes up the carpal. There's the trapezium, which is right under the pinky finger, right here. Right here. Then there is the trapezoid bone, which is right next to the trapezium bone. Then there is the capitate bone, which is right here under the middle finger. Next, there is the hamate bone, which is right here, next to the ring and the pinky finger. Next, you have your scaphoid bone, which is underneath your trapezium bone, right here. Then you have your lunate bone, and that is right here. Next, you have your trichotrum bone, which is right here. And then the last one is the pisiform bone, which is right on top of the trichotrum bone. Little tiny.
So this part right here is the foot. This section up here is called the phalanges. The phalanges is broken up into 3 parts. This part right here is the dorsal part. These 4 right here are the middle parts. And these right here are the proximal parts. This middle part is called the metatarsals, right here. And they are breaking up also into 3 parts. These are the heads, these are the bodies, and these are the bases. Last but not least, we got the dorsal bones, which starts from right here and it's all the way down. The first one we got is the mental bone. The second one is the intermediate. The third one is the lateral. And the fourth one is the cuboid. We have the navicular bone. And then we have the talus bone. And then we have the calculus bone. We also have our transverse arches, which is a triangle. In the middle of the triangle, we got the proximal arch. On this side, we have the median arch. On this side, we have the lateral arch. And above is the interior. The sacroiliac is right here. The pelvic symphysis is right here. The hip joint is between the pelvis and the femur. The knee joint is between the femur and the tibia. The tibular fibula is right here. The ankle joint is right here between the tibia and the fibula. The patella is right here.
This is the right ulna. This is the right ulna. This is the left radius. This is the left humerus. Okay. This is the left clavicle. This is the right scapula. This is the left pelvis. This is the right femur. This is the left tibula. This is the left fibula.
This is a femur. This is your pelvis. A fun fact, the circle that you see right here is called a true pelvis, and everything else is the false pelvis. Also, if you did not know, a male's pelvis is actually more narrow and a female's pelvis is wider. This is your pubis. This is your ischium. It comes up from behind. This is your ilium.